So, being that there's a lot of people who might have a bit of confusion when it comes to recognizing the differences between autism and ADHD, and then also just the fact that quite a bit of people have both, I decided that I wanted to talk about it. So, hello, beautiful souls. Welcome to the journey of discovery of self, of other, and of realms beyond space and time. My name is Adrian, and I'm so glad you're here. I think the main reason I wanted to make this video is because one, I'm ADHD, and two, I tend to see a lot of ADHD content creators talking about either autism or ADHD, and I'll find myself thinking, like they're attributing this to autism, but actually I think that's ADHD, or sometimes the other way around, like I don't know that people with just ADHD experience that in that way. So I'm kind of curious how much I know the differences actually, but I've done a lot of research over the last like 4-ish years or so. So I feel like I tend to notice that and kind of question sometimes what people are attributing what to what. And then also, there's probably a lot of times when people are referring to something that is kind of uniquely a combination of both, meaning like the experience seems to apply exclusively to people who have both autism and ADHD, and not so much someone who has one or the other. So that's interesting. And I will say there is actually like crossover in the experiences, and it's definitely understandable why people mix up the traits and things like that. And then also every individual person is different. So sometimes like certain elements that people are talking about, it's like having to do a lot with like their personality, or like, you know, they're describing some preference of theirs, and that's kind of like regardless of neurotype. So how are autism and ADHD similar? Well, for starters, they're both neurodevelopmental conditions. Both deal with executive functioning issues and difficulty regulating behavior and or emotions. Both people with ADHD and people with autism will have social differences, and autistic people and ADHDers both might mask their social differences in order to fit in with neurotypical people. These things just show up in different ways, or might actually look very similar in outward behavior, but have some slightly different underlying mechanisms. For instance, when it comes to the social aspect, the ADHD person might be finding it difficult to focus on what someone is saying because they've got a bunch of different thoughts bouncing around in their mind, or there's lots of things going on in the environment that are pulling their attention, and they might struggle with interrupting people a lot because if they don't get to express their thought in that moment, they might completely forget by the time the other person has finished what they're saying. And one thing about the attention deficit, people with ADHD can actually be really great at focusing. They have very intense focus at times. It's more so about the difficulty in regulating attention, not that we just can't pay attention at all. Something else about ADHD is that it has to do with a deficiency of dopamine in the brain. So it's also just difficult to pay attention to things that you don't have an interest in. So if a conversation is not particularly stimulating, that can also make it hard to pay attention. And distraction plays a big role in ADHD because your attention can be pulled into another direction. So it's like you're now just might be focusing on the wrong thing, something that wasn't your original intention to be focused on. And so then you got to work hard to direct your attention back to what you were actually intending to pay attention to. And I find at times that, you know, it's like something else could grab your attention and you can get so lost in that thing that you entirely forget about everything else around you. until something else manages to pull you back into the original focus. So with ADHD, those social difficulties can look like people often getting mad at you for becoming distracted, or for interrupting them too much, or forgetting things, or even seeming to miss social cues because you weren't paying attention. So this leads me into autism and what those social difficulties can look like. With autism, you might be missing social cues because you just don't recognize them, not because you're not paying attention. For autistic people to recognize social cues, it takes a lot more conscious effort. Like, it's not something that comes naturally to us. It's something that we have developed the ability to do over time. Like, to use myself as an example, over my lifetime, I've gotten pretty good at recognizing social cues, I think, but I still really struggle at times, mainly when it comes to group settings and people I don't know well. So actually, a lot of the time, instead of masking, I just entirely avoid. And I've also just had a lot, like way too many moments where I feel like there's something that I'm missing and not quite sure what it is, or I think I know like what I'm picking up on, but I'm not 100% sure about my assumption. So I often just kind of go silent because I'm terrified of responding in the wrong way. And this also happens with sarcasm. I know that's like, I guess, a bit of a stereotype, like that we just won't ever get sarcasm. I mean, it's like kind of true, but not entirely. Like, I'm pretty good at recognizing sarcasm, but there are certain people that are just so like deadpan with it. They just say something sarcastic and continue on, never making it clear whether or not they were joking. And it's kind of like, I'm not sure. But like, when you know someone and you kind of know what their beliefs are and such, you can tell when they're being sarcastic based on just knowing what this person really believes. So like, if they say something that you're like, you would never say that, you can be like, oh, they're being sarcastic. But sometimes if I encounter sarcasm where I can't quite tell, I just don't give any sort of response and kind of wait to see if they're going to clarify. And then if they don't, then it might be an awkward situation for me, where they can tell that I can't tell if they're being sarcastic or not. And in general, there's just a lot of things where autistic people just can't quite tell what is expected of them, because neurotypical people tend to expect certain responses or behaviors without explicitly saying what it is they want. So I feel like when it comes to outward expression, it might come off as not actually paying attention to a person because you're not giving the expected response. So in that way, it might look similar to a thing that happens with ADHD. And then another thing that I think can be very similar is often people with ADHD might be very talkative, but there are also autistic people who can be very talkative. And with ADHD, that might just be attributed to like the hyperactivity element and impulsivity, maybe, because they might be interrupting someone to go into their long monologue about something. And then with autism, that might be this element of like intense focus, like maybe they're talking about their special interests, so that could be why they have a lot to say about something, and maybe they don't stop talking because they're not able to always tell if people are actually interested in what they're saying, and then also not sure, or like can't tell when someone might be wanting to contribute to the conversation, because it could be difficult for autistic people to know in conversation when it's their turn to speak. And that's why you'll also see autistic people interrupting sometimes, because they just can't tell when it's their turn to speak. So that's kind of the difference. So autistic people don't know when it's their turn to speak, and ADHDers might be struggling with that impulsivity aspect, or just trying to prevent themselves from entirely forgetting whatever thought came up when someone else was talking. Okay, so now let's just look at the diagnostic criteria. Like for ADHD, inattentive traits are displays poor listening skills, loses or misplaces items needed to complete activities or tasks, sidetracked by external or unimportant stimuli, forgets daily activities, diminished attention span, lacks ability to complete schoolwork or other assignments or to follow instructions. See, I feel like one of the reasons why it took me so long to get diagnosed with ADHD is like, for one, I've always been very afraid of getting in trouble. So like, yes, I have a lot of issues with working memory and forgetting things. Well, for one, in elementary school, you know, the teacher always makes sure that you have your things written down, and you know, like, it's usually when your parents will help you with your homework and make sure that you've done your homework, so it's not really a problem. And then like when I went to middle school, my school was very strict, and again, I'm terrified of getting in trouble. So like, and I would obsessively check things over and over again just to make sure that I wouldn't forget, because I know that I do forget. Because anytime I ever actually did forget something, I would feel so terrible. So there's that. Avoids or is disinclined to begin homework or activities requiring attention. So like, if there's anything that my mom is actually going to notice regarding ADHD traits, it's the procrastination aspect, as that's the thing that I got in trouble most when I was younger, for not starting things that I knew were going to take a while. Let's see, fails to focus on details and or makes thoughtless mistakes in school. Again, that's another thing. Like, I hid that trait of mine by obsessively checking everything. Like, even like on tests and stuff, or like, you know, I learned this from occasionally my own mistakes, but also other people's mistakes, and like things like where the teacher's like, you know, make sure we're checking that, to make sure that there's not a back to these homework assignments and stuff like that. So I'm like, that's the kind of thing I started doing obsessively. And like, even like answering, you know, like multiple choice questions where you're like reading the paper, I'd be like, okay, question 1, and then like on the answer sheet, question 1, I'm like, okay, what was the question? Okay, I think that's B. Okay, question 1, you know? So, so that's like the kind of thing, it's like, you know, I would do stuff like that and always be struggling with the fact that I always feel like I'm working way harder at everything, and no one knows I'm struggling, because the end result is that I get it right because I was so obsessive about it. Anyway, moving on to the hyperactive traits. Squirms when seated or fidgets with hands and feet. So I guess that's something that, you know, can look like autism too, with stimming. So that behavior sometimes might look a lot alike, you know. And I've heard this distinction, like ADHDers fidget and autistic people stim, but I kind of think that both do both in some ways. Like, I think that, you know, because they're like, with autism, it's self-soothing behavior, but I'm like, you don't think that people with ADHD are also self-soothing? Because at times they definitely are. It's not just hyperactivity, like, you know. And then especially when you're different, you know, with neurodivergence in general, anxiety is a very common thing. So like, I feel like probably a lot of times you are also, like, as someone with just ADHD, probably stimming as well. But anyway, And then also, because I've heard someone say, like, it's like excess energy you're trying to release with fidgeting or whatever. But I'm like, okay, but also I think autistic people do that as well sometimes. Sometimes you got excess energy there too, like happy stimming. Like, you ever get really excited and stim? That's like, I don't know, seems like excess energy you're releasing to me. But anyway, marked restlessness that is difficult to control, appears to be driven by motor or is often on the go, lacks ability to play and engage in leisure activities in a quiet manner, incapable of staying seated in class, overly talkative, impulsive symptoms, difficulty waiting turn, interrupts or intrudes into conversations and activities of others, impulsively blurts out answers before questions completed. So that's ADHD. Now let's look at autism diagnostic criteria. So criteria A, persistent deficits in social communication and social interaction across multiple contexts as manifested by the following or currently or by history, illustrative, not exhaustive. Deficits in social emotional reciprocity, ranging, for example, from abnormal social approach and failure of normal back and forth conversation, or reduced sharing of interest, emotions, or affect, to failure to initiate or respond to social interactions. So, I mean, yeah, that's not usually a thing with ADHD. A lot of times people with ADHD are very, like social butterflies, basically. I mean, I'm not, but I'm also ADHD, like I said, and I'm just not at all extroverted. Though I know, like, people with just autism can also be, you know, kind of extroverts and, like, talking to people. But anyway, deficits in nonverbal communicative behaviors used for social interaction, ranging, for example, from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and body language, or deficits in understanding and use of gestures to a total lack of facial expression and nonverbal communication. See, that wouldn't really be ADHD, because usually you're still understanding those social context things. Though you could say that you might not be having normal back and forth conversation, just because of the way your brain works with ADHD, and like the way you'll go off on to all kinds of different topics that to somebody else probably seem like they have no relation to the original thing that you were trying to say. But, you know, it's a little different. It's not quite like this. Because usually with ADHD, you're still going to have an understanding of body language and gestures. Deficits in developing, maintaining, and understanding relationships, ranging, for example, from difficulties adjusting behavior to suit various social contexts, to difficulties in sharing imaginative play or in making friends, to absence of interest in peers. I guess with ADHD you could also have trouble with friends, but again, for different reasons. With autism, it's probably going to be more so that, like, you're just not really understanding that dynamic as well, or like for one thing that people talk a lot about, like knowing the difference between like romantic and platonic, which, I mean, really, like, yeah, like I kind of get that. I mean, like, obviously there are a few clear things that are like, okay, this is romantic sexual relationship, like, you know, like we're not having sex with friends, that's clear. But also like just other things. And then especially if you're socialized female, girls are a lot more like touchy, I guess. You know, like you're hugging, holding hands, cuddling with friends sometimes, and it's kind of like, so when does it become romantic, you know? But then also things like knowing how to act around like school to like outside of school, or like work, how you're supposed to act with your coworkers versus outside of work, that kind of thing, can be difficult for autistic people, and not really so much a thing with ADHD. Though I guess with ADHD you might just kind of like not care as much in certain aspects. Like I feel like with ADHD you might be more likely to be the type of person who's like oversharing in situations, just like talking about anything. But yeah, okay, so B, restricted repetitive behaviors, patterns of behavior, interest, or activities as manifested by at least two of the following currently or by history. Stereotyped or repetitive motor movements, use of objects or speech, simple motor stereotypes, lining up toys or flipping objects, echolalia, idiosyncratic phrases. Okay, so this is like stimming behavior, which again you might kind of see with ADHD too, with fidgeting or stimming behaviors. But you know, with autism, you're more so these more stereotypical behaviors with autism is how you're gonna see the difference here. Insistence on sameness, inflexible adherence to routines or ritualized patterns of verbal, nonverbal behavior, extreme distress at small changes, difficulty with transitions, rigid thinking patterns, creating rituals, need to take same route or eat same food every day. So that's a thing that's kind of going to be almost entirely opposite with ADHD, because with ADHD you're always craving novelty, so you're always wanting to do new things, and like that impulsivity aspect of just like wanting to go and do something spontaneously. So you're not usually interested in sticking to routine. You're always wanting to do something different. And like that's the thing with like ADHD, that can make both of those things hard to diagnose, because it kind of looks like neither sometimes. I feel like a lot of people, or like a lot of times you could also, usually someone is kind of more one or the other. I feel like in that way I'm more like, I like to think that I'm spontaneous sometimes, because you know, I might think that a lot, like, oh, I want to do something, but then like when it comes to actually doing it, I'm like, no, we're doing the same thing. This is what we do, you know. So, highly restricted fixated interests that are abnormal in intensity or focus. This is something that you'd probably relate to special interest with autism, but also with ADHD there's this element of hyperfocus, though that's not exactly in the diagnostic criteria for ADHD, but they're definitely something that is talked about in literature with ADHD, is this element of hyperfocus. But usually, so I guess the difference would be here, usually that's going to be something that's more short term as compared with autistic special interest. So you might get really focused on something, or even like tasks at certain time, really focused on like rearranging your entire room, for example, with ADHD. But it's like this, you know, short-term thing, whereas with autism, like you'll have a special interest that's been ongoing for several years. But I mean, also with autism, you can have more than one special interest, and that they might also change over time, but in general, it's going to be more long-term than with ADHD. Hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment, indifference to pain, temperature, adverse response to specific sounds or textures, excessive smelling or touching of objects, visual fascination with lights or movement. So, in the past, this is something that I would have been like, yeah, that's like autism, not ADHD. But then more and more I hear people talking about sensory issues with ADHD. So I'm starting to think that, maybe I can't really strictly say that. But I still kind of feel like it's going to be more so with autism. Because I feel like, I don't really know autistic people who wouldn't have sensory issues, but with ADHD, you might or you might not. So that's that. So to wrap this up, probably the best way to tell the differences between the two is think about what is going on behind certain behaviors. If it's having to do with attention, focus, forgetting things, procrastination, careless mistakes, restlessness, hyperactivity, issues with patience, interrupting, and impulsivity, that is ADHD. If it's involving difficulty initiating or holding conversations, not understanding nonverbal communication, or having others not understand yours, difficulty with adjusting your approach and behavior in accordance with differing social contexts, overall having that experience of being very socially awkward and feeling excluded and having trouble making friends, or even just not being able to integrate into group settings, having a very palpable experience of you just not belonging in every social situation you've ever been in. Need for stimming, though it's a little ADHD too, but especially those stereotypical autism stims. Need for sameness and routine, not coping with change, sensory issues. Again, seems it could be ADHD, but I still lean a little bit more towards that being more so for autism. But yeah, that's autism. Those things you can attribute to autism. So that's where I'm gonna wrap this up. Hope you enjoyed. Please feel free to give this video a thumbs up, comment down below, and subscribe to this channel. And I will see you in the next video.